Hi, today we are here in Facialteam Marbella in our facilities in the operating area. Here is the operating room number 2, and we're going to be inside operating a forehead. Today I'm going to introduce you our FOREContour method. FOREContour is a method that we have developed during the last 10 years with more than 2,500 patients that summarizes this 10 years of experience, offering our patients a very innovative method and totally individual approaches.
Hi, my name is Carlos Bailon and I will be one of the surgeons today in the operating room. I have prepared the approach for the forehead contour technique and put a local anesthesis. The nurses are preparing the surgical area now.
Before starting the surgery today, let's jump back to one of the most important parts of the FOREContour technique, the planification. So let's see how it goes. The very first step is understanding really well the anatomy of our patient, how her facial structure is. So a 3D CT scanner is conducted. With this 3D imaging based on the CT scanner, we introduce the data in a very specific software where we plan all the details and all the surgery. Once we have all the data within the software, we analyze and measure the frontal sinus structure. We measure volume, we measure extension, we measure projection, and we base our planification in all these measurements. With all these measurements, remember projection, lateral extension, volume, air cavity, now we can create the surgical guide. The surgical guide will allow us to precisely cut the anterior wall of the sinus. This guide will be printed and now is with us in the operating room. Now we are ready for surgery. Let's go. During the preparation of the case, we have made the incision, that in this case a very posterior incision. Why? Because it's the ideal way to hide the potential of the future scar. Here is the strip that we are going to remove, and from here we will arrive to the forehead region. Once the strip has been removed, now we have to detach everything till we arrive to the region where the forehead will be recontoured. Now that the whole flap has been raised up, we go to the second layer, to the pericranial flap. It's a very extensive flap of the layer totally adapted to the bone. So now we are going to expose the bone. The whole region is now totally exposed, and we have identified the key areas, the frontomalar and nasal bones. So now we can start with the reconstruction.
This is the surgical guide that we generated before the surgery, okay? We use to do the osteotomy.
Now that we have completed the bone cut, the osteotomy, with the piezo surgery, we are going to take out the anterior wall of the frontal sinus. During this new surgical step, we are shaving or burying the bone surface around the frontal sinus that allow us to contour, to soften, to round the whole forehead surface. Well, the bone shaving is done. Here we have the anterior wall of the frontal sinus. Now we are going to soften the inner wall of the bone, and after this we have to close the sinus according to the new shape surrounding. So it's when the proper reconstruction begins. Surprisingly, and probably this is the magic of forehead reconstruction, now the anterior wall is bigger than the sinus, so we need to adapt it.
In this case, we use only 2 plates to fix the anterior wall of the frontal sinus.
Now we are designing the orbital opening. The orbital opening is a very essential maneuver to better expose the periorbital content, making great changes in the patient expression. We are getting close to the end of the surgery. Now, a very nice step we are going to make. We are going to soften and we are going to reduce the profile of the material to make it really unnoticeable.
We have placed the drain that we will remove tomorrow.
Now we face the very final step of the procedure. We are going to reposition the eyebrows in a very slight higher position. Let's go for it. Well, we finished the surgery a few minutes ago. We are very glad so far. The planification made by Carlos was extremely good, was very accurate, bringing predictability and safety to the procedure. With all the anatomical changes that you have seen during the procedure, the patient gained expressiveness and femininity. This is the clear objective of the FOREContour method. If you are a patient and you are interested in learning more about the FOREContour method or any other feminizing procedure, please don't hesitate to book your consultation here in Marbella.